So welcome again. This is your friend, No Solution. Can smoking during pregnancy increases the chances of gestational diabetes, that is diabetes during pregnancy? Yes, cigarette smoking during pregnancy may increase the likelihood of developing gestational diabetes. And when we're talking about this, cigarettes contain toxic and harmful chemicals such as nicotine, carbon monoxide, which interferes with the body's ability to use insulin. And that insulin is what digests our carbohydrates after food. But when this insulin is no longer functioning as intended, as it should, blood sugar levels can rise, which increases the risk of developing diabetes, or what we call gestational diabetes. That is diabetes during pregnancy. Research shows that women who smoke have a higher risk of insulin resistance, which can resultantly lead to complication for both the mother and, of course, the unborn baby. So, quitting smoking in advance of pregnancy or during pregnancy, what will it do? May lower this risk and improve the general or the overall maternal and the unborn baby's health. So there is a significant relationship between smoking, gestational diabetes, and preterm deliveries, preterm birth. So women who have gestational diabetes are already at a higher risk for early delivery. And what happens? Smoking worsens this risk. So the best thing if you are planning to get pregnant is to stop, quit smoking before that, or as soon as you know you are pregnant, you do that. Smoking also reduces oxygen delivery to the baby, which will adversely affect the growth and early labor. Babies born prematurely may suffer various complications from breathing problems, low birth weight, and of course developmental delays. Do you understand? So avoiding cigarette during pregnancy helps prevent these complications and promote a healthier pregnancy for both the mother and the child. So when we're talking about smoking, then does smoking affect how placenta regulates sugar during pregnancy? Of course, smoking impairs the ability of the placenta to regulate blood sugar during pregnancy. Do you understand? So, and when we're talking about this placenta, the placenta is responsible totally for providing the baby with nutrients, oxygen, and it also helps the mother to control her own blood sugar levels. So when a pregnant woman smokes, harmful substances such as nicotine, carbon monoxide reduces oxygen supply to the placenta. You can see where the complication is coming from. And of course, this disturbance disrupts the action of insulin, which increases blood sugar levels and also increases the risk of gestational diabetes for the mother. Additionally, the nicotine will affect hormones released from the placenta, which are responsible for regulating glucose metabolism in the system. You understand? So this could now lead to insulin resistance, and when it happens, it creates a more difficult environment for mothers to control their blood sugar. As a result of this, what happens? Both the mother and the baby may experience various health complications. You understand? So it is better to quit smoking before you get pregnant, because babies exposed to high blood sugar in the womb are also at risk of excessive growth, too big for age, premature birth, future metabolic disorder. So quitting smoking before or during pregnancy improves placenta function, insulin function, support healthy blood sugar regulation, and of course reduces the risk for both mother and the baby. Remember, health is wealth, and see you in the next video.